So let's talk about the nasal spray options available to you from your pharmacy for hay fever. Over this side here we have your steroid-based sprays. Now they work in two ways. One, they reduce the inflammation and swelling in your nose, and the second thing they're doing is telling the body to stop overreacting to whatever you're allergic to that is causing your hay fever. Now they do take about 3 to 5 days to start to work, so always give them a chance. The most common side effect with them is a bleeding nose. So if this does occur to you, the recommendation is to stop using it for about 3 to 5 days, let the nose heal, maybe use some saline spray in between, and then start using them again if they do work well for you. Now Rhinocort's the only one that is safe to use during pregnancy. All the rest you'd have to have a chat to your doctor about the continuation on during your pregnancy. Other options obviously involve things like Zyrtec. Now Zyrtec is just a straight antihistamine. It is just telling the body to settle down and stop overreacting to the allergens or whatever is causing your hay fever. Then you have things like your Atrovent nasal fort spray. Now that is a medication that essentially is just telling your body to stop secreting things, so there'll be less secretions coming out of your nose. Now if these guys haven't worked for you in the past, you can talk to your doctor. The doctor does have a couple more medications that they can prescribe for you. They are also all quite safe to be used at the same time as an antihistamine tablet or an antihistamine eye drop as well. So pop down to your local pharmacy, have a chat to them about the different options you have available to you for your hay fever. So a lot of people don't use their nasal sprays correctly. What they do is they sniff too hard, and all that does is send the drug straight to the back of the throat. It does nothing for you except taste disgusting. Or they haven't cleared their nose and it starts dribbling out the front. So the recommendation is obviously to clear your nose, tilt your head forward, get your nasal spray. I use opposite hand for opposite nostril. Get the spray into your nose. Now breathe out and then breathe in normally and spray. And then obviously we have two nostrils, so we swap hands and we use the other side. Now, if you needed to give yourself a second dose, the recommendation is to wait about 30 seconds to a minute, let that first spray be absorbed in. Otherwise you'll find it will trickle out the front or will trickle down the back of your throat and taste disgusting. So that's the best way to use your nasal spray.